Hello everyone and welcome to Inside Healthcare. I'm Jody Rataga, and joining us is a very special co-host, Allie Larkins. We're very pleased to have you with us. Thanks, Allie.
Thanks, Jody. Hi everyone, my name is Allie Larkins and I'll be a senior at Marquette University this year, majoring in public relations, and I'm interning with Jody at Health East for the summer.
And Allie, we have a good program and we're going to be talking about some important issues here. And did you know that there were nearly 400 cases of whooping cough in Minnesota since June 30th? And that's not just here in Minnesota, it's around the country. And we're very pleased to have with us a very special guest back with us, Dr. Ryan Dick. He's a physician with the Health East Van Ness Heights Clinic, a family medicine physician. So thank you so much for being with us.
Thanks for having me.
So what are you seeing in the clinic? Are you seeing a lot of cases, and are there certain populations that are being affected by it more than others?
As far as the numbers that I'm seeing in clinic, I probably have seen a few cases over the last 6 months. The reality is, with the recent increase in numbers in Minnesota and then again in other states as well, we'll probably be seeing far more numbers than we've seen in previous years. In Minnesota alone, and we've seen, I think, already 3 times the number that we've seen in the year of 2011. Yes, it is quite amazing. So we'll be seeing far more, I think, in the next 6 months.
Wow. And doctor, can you tell us a little bit more about whooping cough? You know, how serious is it and how do you get it?
Okay. So whooping cough is caused by a bacteria called Bordetella pertussis. It is a bacterial illness, and it's transferred from person to person the same way that a cold is transferred. As far as the seriousness of it, the symptoms can really vary quite a bit from person to person, which sometimes makes it a little bit more difficult to identify. It starts as a normal cold, but then obviously the symptoms can become serious, and that's why it's probably gained a little bit more attention in the media today. That we have epidemics now in the state of Washington, and we're also seeing obviously higher numbers here in Minnesota as well. You can have mild symptoms, and then you can have people who go to the hospital with that kind of illness as well.
What would be some of the symptoms that you get with whooping cough, and then how do you treat it?
Okay. So as far as the symptoms themselves, once you've obtained the illness itself, typically it takes about 7 to 10 days to start having actual symptoms itself. So you've been exposed to someone who has been probably coughing, has pertussis, and within about 7 to 10 days you'll start having some mild nasal congestion, and that will typically get a little bit worse over the course of about a week or 2. Oftentimes we will have coughing symptoms. I mean, that's why they call it the whooping cough. And the symptoms themselves can be really dramatic, to the point where you cough, 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 you're unable to stop, and to the point where you actually get short of breath, and then that's when you take that really deep breath in to catch your breath, and that's where the whoop comes in. Now that's the classic piece of the symptoms themselves. A lot of people will just have a prolonged cough and not really know why. You don't always have to have that whooping piece of it, and that's why no, and so that's why we're trying to make our patients more aware of the symptoms themselves, that if they have a cough that's out of the ordinary for them, that's the point in time where we want to see them in the clinic.
Okay. And what about the vaccine? I thought that if you or your family is vaccinated that you are protected against this disease. Is that true?
It is true to some degree. The good news is that when you are vaccinated, that you are protected oftentimes from either getting the illness, or at least it makes the symptoms milder. The tough truth about all vaccines, not just pertussis vaccines, is the fact that there is no vaccine that is 100% effective. The reality is, we know that people who do get the illness of pertussis, a lot of those people are people who have been vaccinated, but their symptoms are milder, and those are people who typically don't have to go to the hospital with their symptoms, and they're also much less contagious, and so they're not as likely to pass that illness along to other people. We're really trying to not only protect adults, but we're trying to protect young kids, and really trying to make sure that all caregivers, even if adults, are not worried about getting the illness themselves, they're really just protecting their young ones.
And this is a very serious disease.
It is a really serious illness. In cases, there have been at least 8 deaths in the United States itself. Usually that occurs in kids who are really young, under the age of a year.
How frightening that would be.
And that would be a really frightening thing to have parents. And this isn't obviously meant to be any scare tactic to convince parents that they need to have their children immunized, but it gives parents something to think about, but that this is really something in a lot of cases that's preventable. It's also something that if the kid does get it, or a parent would get it, at least the symptoms are milder or they are less contagious as a result of getting the vaccine.
So who should come in to get a booster shot or get the vaccine then?
So just starting off with kids to begin with, there is a series of pertussis, diphtheria, tetanus shots that kids get all at the same time and as part of the same vaccine between the age of 2 months and 5 years. And so that's where we start off with a vaccine. Most kids will get a booster shot at the age of 11 or 12, and then all adults are typically immunized for a final booster shot when they are older than the age of 21 or 25 years old. They'll be getting their 10-year booster. They are reevaluating vaccines themselves to see if we need to be doing this more regularly. Should we be modifying the vaccine just to make it more effective? I mean, we would like to see these vaccines be 100% effective, and science, is working towards that.
Okay, and if you'd like more information on whooping cough, you can visit the Minnesota Health Department's website, or you can call the Health East Vadnais Heights Clinic.
Yeah, perfect.
Well, if we might change the subject just a little bit.
bet.
Recently you were quoted in the Pioneer Press
Yes.
giving a warning out to seniors. What do you want them to know about? And was it about the alarm systems or the alert
Yeah.
systems?
I received a phone call to my home in regards to alarm systems for elderly individuals, and unfortunately they were giving some pretty poor medical information and really trying to scare elderly seniors or even just any kind of a vulnerable adult into buying an alarm system. The number one thing that I would encourage adults who are interested in an alarm system for whatever reason is to have a really good one-on-one conversation with the regular family or primary care physician. The reality is that the vast majority of my patients don't fortunately need a system like that. They're too healthy to need one. But if someone is interested in one or feel like they might be at risk for a fall or some kind of heart condition that requires one, then that's something that I always want to talk to them one-on-one about.
Okay, and do you have any other advice for seniors or for families with aging parents about these alert systems?
I would say the number one piece of advice would be first going to the family physician, having the family come in with that patient of concern, because I always like to see more people. I always get added perspective from the families when we have those conversations. But the other piece of it is don't take advice from someone who's trying to sell you a product on the phone. They use every tactic under the book to convince you that you need a system like this. So before you make that leap and actually invest in something like that, maybe we need to get you a specific type of system. Maybe it's not a matter of whether you need one, but what kind, and we can work with you to make sure that we get you safe at home. The other piece of it too is we have nurses that will visit people at home to make sure that people are safe and help some preventive pieces, making sure that the house isn't at a high risk for falls, that there's we can avoid steps, things like that, so that maybe we don't even need an alarm system in the home anyway. But ultimately, just go back to your regular doctor, a doctor that you trust, to talk about that more in depth.
So they randomly just called your home
Absolutely.
and they were trying to sell you the product.
They asked me to stay on the line if I was interested in an alarm system, and I stayed on the line to file a complaint. And when I tried to file a complaint, they hung up on me. And so the reality is that I went through the Better Business Bureau. They're investigating it further. But ultimately, we have a lot of people who are trying to sell a product to people who might be vulnerable. They might not understand what an alarm system does or whether they actually need it.
Well, great advice.
Yes.
As always.
Thank you.
Thank you so much for joining us, Dr. Ryan Dick, and we hope you can join us again soon.
All right, thank you so much.
Always great to have you
Yeah.
here. Still ahead, how you can get a workout with a personal fitness trainer without even going to the gym. We'll tell you all about it and the exciting new fitness program when we come back.
In 1990, in Severn, Maryland, the daughter of a clergyman was discovered by a music industry insider while pumping gas at a service station. The odds of her getting signed and spending 11 weeks at #1 on the U.S. singles charts? 1 in 19 million. odds of this former church choir singer going on to sell 40 million records, 1 in 15 million. The odds of the same woman winning 6 Grammy Awards and starring in 2 Broadway plays, 1 in 75 million. The odds of this musician and performer having a child diagnosed with autism, 1 in 150. I'm Toni Braxton, and I encourage you to learn the signs of autism at autismspeaks.org. Early diagnosis can make a lifetime of difference.
Welcome back to Inside Healthcare. With us now is Beth Durkising. She's a nutrition and fitness specialist from Woodwinds Ways to Wellness. Beth, thank you for joining us.
Thanks for having me.
She's here today to tell us all about an exciting new fitness program that comes right into your home or even in your office or when you're on vacation. Beth, what is it?
Yes, we're very excited and pleased that we could add this into our program. It's a Skyping option. So what's fun about that is the workout can come to you. You don't necessarily have to come into Ways to Wellness to get, to take advantage of that. So all you really need is your own personal computer at home with a webcam or even any type of tablet such as an iPad, and that workout can come right into you. It's pretty simple and straightforward, and it's a free service. The Skype service is a free service that is really user-friendly too.
So how does this work? You sign up for this, and then you have a scheduled time that you meet with the personal trainer, just like you would at the gym or something?
Exactly. What we do is you kind of choose whichever program through Ways to Wellness is going to benefit you to get to your fitness and wellness goals. And we have an allotted time that you're scheduled for, and so it helps with accountability too. So you have that 6:30 a.m. appointment with us. We ring you up on Skype, and we get started with whatever you're going to be doing, whether it be nutritional consultation or even a workout. So it's pretty good. It helps keep people accountable too.
Do you have to be a patient or a client of Woodwinds Ways to Wellness to take advantage of this program?
Yeah, you don't necessarily need to be a patient, but to be a client is something that is necessary to get in with us, kind of get all your paperwork done for liability reasons, and then any of our services available, most of our services available at Woodwinds Ways to Wellness program are also available through Skype. So, yep, so it is, but there's no need to be an employee, or it's really open to anybody within the community. Actually, not even in our community, because we can reach far and wide. If you live in Australia, we could even hook you up.
Yeah, just mentioning that, this Skype program was recently featured on Twin Cities Live with a client based in California, correct?
Correct.
And so really anyone anywhere can do it, and as you mentioned. So I'm wondering just if you could tell us a little bit more about cost.
Yep, the cost. What's nice too is the Skype option is not any more than any of the options as if you would come into us. So if you look at our website too, all of the prices listed on our website for the one-on-one consultations, whether it be personal training or nutritional consultation, those are all the same price if you would Skype through us. And so it might end up even saving people money because you don't have the transportation cost and just the time on the road. Maybe if you live, half an hour away, you think of the gas money and
rush hour.
The rush hour and all those unexpected things that can come up along the way to Woodwinds. Sometimes it's not unforeseen for us to get 2 feet of snow in the winter and then you end up missing your appointment. Where here, you can work out in your pajamas if you want with your cup of coffee next to you. So the comforts of your own home sometimes are nice. And even those people, too, that travel for work, sometimes you travel or maybe you even go on vacation and you fall off the wagon with what you were supposed to be doing to try to help your wellness. And this will just help keep you accountable because it removes some of those excuses that get in our way with our fitness. So
very exciting. And I understand it's one of the first of its kind in the country?
It is, yes, it is. We're trying to really move forward with some of those technological advances that are at our disposal. And so we wanted to be one of the first to offer such a deal. So we're pretty excited about that.
So once someone signs up to become a client, then they have a set appointment. And then you mentioned that there were different programs. What would be some of the programs that someone could do through Skype as well as at the center itself?
It's a very good question. We do have, like I mentioned, nutritional consultations, and it's all one-on-one. So because we are all dietitians and personal trainers, we do offer a wide variety. So For example, if you need 30 minutes of just going over your diet and your food log and what's going wrong with the food, we could use it as that. We also have health and wellness coaches that work with us. And they're really good at helping you try to figure out what internally motivates you. And so maybe you're set up to have a session with the dietitian, and then you realize a day ahead of time, boy, I think I really need the health and wellness coach. We can just mix and match. The personal training piece is nice too, because like I said, it's a live
really
video.
like that, yeah.
Yeah, so we can see your form while you're working out and exercising and correct you on that if you're doing something wrong. And you can also watch us and kind of mimic what we're doing as we're showing you the different exercises that we want you to do. So it's really interactive, very user-friendly.
Really
Exactly. Yep, you're really there. You're like looking through a window at someone. So it's a very nice option for people that aren't close in vicinity to us too.
Yeah, it's a lot nicer than some of the maybe the DVDs or the programs that you're just watching.
Trying to keep up with.
Pre-recorded one. And
yep. For example, if you're watching Jillian, she's not going to stop the video because you're lunging incorrectly. So, and there's a lot of safety issues when you exercise, and if you're exercising on your own and your form isn't correct, you're going to risk an injury, and that's just going to set you back further, getting to your goals. So it's a great tool to take advantage of.
what do you think about it?
I really like it. It's really fun, and it's just new and different, kind of mixes up what we've normally been doing, and so I think, again, like moving forward with technology is the best way to reach people. I've enjoyed working with it so far. So
if someone's interested, how can they go about signing up or becoming a client or learn more about it?
yeah, the best way is to call our number during Monday through Friday business hours, and our number is 651-232-1926. And you'll want to ask for Lisa. She's the know-all at Ways to Wellness. And the other way is just even checking out our website at www.woodwinds.org/Ways to Wellness. And then you'll be able to see on our menu all the different options available through Skype.
Great.
Or you can be our fan on Facebook. If anyone has Facebook, which a lot of people do. That way you can also get tidbits and information, updates. Sometimes we'll even put recipes on there or what's new at Ways to Wellness.
I think I saw something not too long ago where you were talking about how you can have a healthy skin, even to make younger looking and things like that by what you eat.
Yes, who doesn't want that, right?
Great tips. So.
Yeah.
It's a pleasure to have you with us. I'm glad to have you back. And
thank you. Maybe I'll see you guys on Skype.
Yes.
Well, thanks, Beth. Really appreciate it.
Thank you.
Thank you.
And we appreciate you joining us. We'll hope you join us next time on Inside Healthcare. And we'd like to thank our special co-host for today, Allie Larkins. It's been great having you with us as well.
Thank you for having me. I enjoyed it.
Thanks, Allie. And thank you. We'll see you next time.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.
If you could see anything in the world, what would it be?
I'd love to see Paris.
I like to see cupcakes falling from the sky.
To save your vision in the years ahead, call your eye doctor for a comprehensive eye exam today. Then call 1-800-437-2423 or log on to seeabettertomorrow.org to learn about glaucoma and macular degeneration.
I just want to see more of the things I love.
purpose of this video is to help increase public awareness through law enforcement at highway rail grade crossings and along railroad rights-of-way. The following points will be covered. Reason for enforcement of laws. Types of warning signs and signals. Laws and civil rulings concerning crossings. Available enforcement tools. Trespass dangers. Grade crossing collision investigation. How to stop a train in an emergency. And malfunctioning signals. You're about 40 times more likely to die in a collision with a train than with another motor vehicle. The number of highway rail grade crossing collisions is much lower than traffic collisions. But, as you can clearly see, the severity rate is much greater. Operation Lifesaver was created in 1972 in an effort to reduce the number of fatalities and injuries occurring at highway rail grade crossings. Nationwide, train vehicle collisions have been reduced by more than 50% through public education efforts and engineering improvements at crossings. However, they are still at unacceptable levels. Education and engineering is not enough. Effective law enforcement is also a necessary tool in helping to reduce unsafe and illegal behavior that, all too often, leads to a tragedy.
The National Transportation Safety Board says it's trying to find out how the steel truck ended up on the track.
The difference in weight ratio between an automobile and the average freight train is about 4,000 to 1. In a collision, the heavier object will always prevail. It's like an automobile running over a 12-ounce can of pop. When 12 million pounds of freight train meets a 3,000-pound automobile, it's no contest. Weight is also a large factor in the ability to stop a train. An automobile traveling at 55 miles per hour can stop in about 200 feet. A tractor-trailer rig at the same speed will take about 300 feet, the length of a football field. The average freight train at 55 miles per hour, on the other hand, will need a mile or more to stop. That's 18 football fields. Trains have a much lower coefficient of friction than motor vehicles. This is due to steel wheels riding on steel rails. The contact area between a train wheel and the rail is only 3/4 of an inch wide, or about the width of a dime. In contrast, motor vehicles with rubber tires riding on pavement have a greater friction area and can stop much faster. So avoiding a collision is logically the responsibility of the motorist. There are two types of highway rail grade crossing warning devices: passive and active. Passive warning devices consist of advanced warning signs, pavement markings, stop signs, and crossbucks. The crossbuck is a regulatory sign that means yield when a train is approaching within 1,500 feet of the crossing. Active warning devices consist of flashing red lights or flashing red lights with gates. It is illegal to go around lowered gates even when a train is not approaching. The U.S. Supreme Court has held that the responsibility of a person approaching a highway rail grade crossing, whether driving or on foot, is to look and listen before crossing the track. The primary violation committed at a crossing is failure to yield to a train. This violation serves as a basis to civil rulings related to highway rail grade crossing safety. A citation or summons is an indication of probable cause that a traffic violation has occurred. It is the responsibility of the courts to determine fault and assess appropriate penalties. Without active law enforcement to help change motorists' behavior at highway rail grade crossings, tragic scenes like these will continue to make headlines across the nation. On a local level, there are things you can do to enforce highway rail grade crossing laws or make motorists aware of crossing safety. You can park your patrol vehicle in an inconspicuous location near a crossing while completing reports and observe vehicular traffic. You can also park your vehicle in a conspicuous spot to remind motorists to slow down, look, and listen. One law enforcement program of Operation Lifesaver is Officer on the Train. It allows law enforcement officers to get a first-hand look from the engineer's perspective of violations and the dangers at crossings. Radio communication is supplied between the officer in the locomotive and ground support officers who will take appropriate enforcement action against crossing and trespass violators. The growing trend of trespassing on railroad rights-of-way is a major concern of Operation Lifesaver. More people lose their lives illegally entering railroad property than are killed in crossing collisions. Active enforcement is essential in helping to reduce this dangerous and illegal activity. Railroads consider trespassing a serious safety hazard and will sign a complaint against the offender.
A dramatic bridge fire has shut down the main north-south railway.
Trespass activity often leads to acts of vandalism that can result in extensive property damage, serious injuries, and even loss of life. The Grade Crossing Collision Investigation course is designed to teach law enforcement officers how railroads operate. It provides valuable classroom and hands-on training that assists officers in conducting proper investigations of grade crossing collisions. Unlike what most officers are accustomed to, this is a unique type of traffic collision, and the training provided helps to bridge the communication gap. There are several courses available through Operation Lifesaver that vary in length and detail. In case of an emergency, it may be necessary for you to stop a train to avoid a threat to life or property. You can contact your dispatcher, who should have a listing of 24-hour railroad emergency numbers. Many crossings also have railroad emergency numbers posted on conspicuous fixtures, such as a maintenance bungalow or crossbuck post. A unique DOT number generally accompanies the emergency phone number and will help the Railroad Communications Center pinpoint the exact location in order to provide warning to approaching trains. It may be necessary to stop a train by flagging. The Universal Railroad Stop Signal is a lighted flare swung back and forth horizontally across your body. If a flare is not available, a flashlight may be used at night or a brightly colored object in the daytime. The locomotive engineer should acknowledge this signal with 2 whistle blasts and will stop the train. Remember to consider the train's long stopping distance. Be sure to stand a safe distance from the rail and do not stop your patrol car on the tracks. If possible, park nearby and turn on the emergency lights to attract attention. Occasionally, you may come upon a malfunctioning crossing signal. Problems can develop which may cause a signal to activate even though a train is not present. This is known as a false activation. Safety features are built into every active signal system that will allow operation in case of electrical or mechanical difficulties or tampering. Keep in mind, however, even with this built-in safety feature, it is still possible to have an activation failure. Although rare, an activation failure occurs when the presence of a train fails to activate the warning signals. Always report a false activation or an activation failure to the railroad immediately through your dispatcher or by calling the emergency number posted at the crossing. When signals are malfunctioning and the crossing gates are down, only law enforcement officers or authorized railroad personnel can direct traffic around the lowered gates. Active law enforcement is an essential part of Operation Lifesaver, and your help in applying the information discussed in this video will help save lives at highway rail grade crossings and along railroad rights-of-way.